disorder. So as I said earlier on, I hope you have pen and paper ready to take lots of notes. There may be some of you who have done a lot of reading already and know a lot. I hope this evening will be a refresher. For those of you who have some knowledge on nutrition in sickle, for those of you, this is your first time and you've got little knowledge, I hope that you'll be able to gain some helpful and useful information from this first session. So I'm going to start. I just need to check about, yeah, let me start. Great. So as I mentioned, this is the first of 4 virtual sessions on the topic of managing nutrition in sickle cell disorder. And this first session will be an introduction to sickle cell nutrition. So I'm going to start by giving you an overview of what the 4 sessions will entail so that you know, and hopefully you'll be enticed and intrigued enough to join us for the remaining 3 sessions. So tonight's session 1, is, as I mentioned, an introduction to sickle cell nutrition, the clinical causes of sickle cell nutrition, the specific nutritional implications of sickle cell disorder, and then also an introduction to the Sickle Cell Nutrition Eat Well Guide. Session 2, which is next week, we'll be looking at getting you to know a little bit more about sickle cell nutrition, your nutritional needs, risks, and challenges living with sickle cell disorder, some of the sickle cell specific related factors affecting your nutritional needs, and we'll also be applying what we learned tonight about the Eat Well Guide to support your nutritional choices and behaviors. So this evening, you'll be learning what that is, but in session 2, in a week's time, we'll be looking at applying that knowledge. So please do join, and hopefully that you'll find that beneficial as well. So the third session, which will be in 2 weeks' time on the 26th of March, that will be a focus on key nutrient deficiencies. And again, we'll be touching on what those are this evening. We'll be looking at additional factors linking nutrition to health and well-being. So we'll be looking a little bit about self-care as well during that session, and then nutritional strategies to help you live well with sickle cell to optimize your health and well-being. So I'm excited about presenting that one because I haven't done that before. And then session 4, which will be the 2nd of April, and that will be lots of practical tips on nutritional strategies to help you better manage common nutritional problems to improve your health and well-being. And this evening, we will touch on what those common nutritional problems are. So if we move on, 1 second. I'll be keeping an eye on the time so that I don't keep you longer than what is needed. So this is just to run through the agenda so you know what to expect from this evening's session. So there'll be 4 parts to this evening's session. Part 1 will be the introduction and overview of sickle cell nutrition. And this is giving you information about why nutrition in sickle, because many people don't quite know the link between sickle cell and nutrition. So this is an important part to lay the foundation for the talk and for the series as well. Part 2 will be an introduction and overview of Sickle Cell Nutrition Eat Well Guide. So if you haven't already seen it, I'll be introducing that to you, and hopefully after the session, you can download your own copy. Part 3 will be an introduction to some of the nutritional implications in sickle cell disorder. So this nutrient deficiencies that I mentioned earlier on. And I like to end off each of my sessions with some helpful tips on empowerment and lifestyle so that you can have something tangible to go on with. So before I start, a little bit of background about who I am. So you will tell by the accent that I'm not British by birth. I was raised in South Africa during the apartheid regime, and so experienced my own, episodes with racism, marginalization, and disempowerment. And this has really helped me to have an understanding and an empathy for working with the sickle cell community. And this has also left me with a worldview for social justice, advocacy, and empowerment. And it's just wonderful that I get to live out that worldview doing what I'm doing in advancing sickle cell nutrition. So I moved to the UK in 2000 with my husband and was introduced to sickle cell disorder in 2011. But it's only in 2014 that I became aware of sickle cell nutrition, reading an article that doesn't even mention sickle, but I saw sickle cell in the article and looked to the literature and found that there was a lot of research, but there was nothing done to improve and advance the access of sickle cell patients to nutrition. So I wanted to change policy and practice, and to do that, I was advised by a GP that I needed to do a doctorate in sickle cell nutrition. So that's what I did. In 2016, I started my professional doctorate degree, self-funded because there was nobody at the time that was interested in supporting me, and completed the doctorate in 2023, so not too long ago, and also founded my non-profit organization called Sickle Cell Nutrition Academy in 2023. And this was to give me a platform to be able to implement the recommendations from my doctoral research. And so currently I work as a consultant dietitian, advancing sickle cell nutrition, both nationally and working towards supporting patients on the ground as well. So that's a little bit about background about me. So we'll go on to part one, the introduction and overview of sickle cell nutrition. And so it's important, when I did my doctoral research, the aim of the research was all about finding ways to integrate nutrition into standard care so that patients can have access to nutrition as part of, the care that you already receive for your medical problems. And the reason why that is important is because safety. It's important that any care that you provided, even if it's your medical care provision as well as the nutritional care provision, that safety, the quality and the level of care that's provided is very important. And I wanted that, and I want that in terms of nutrition as well. Thinking about your overall experience, along your patient journey, looking at your experience with your medical management, but also thinking about what is your experience with nutrition so far. Has it been a good experience? Have you had access to, because I know that many patients haven't had access to nutrition currently as part of their standard care. And so what's also important is looking at your quality of life, living with sickle cell disorder. So not only in terms of your medical, but certainly in terms of your nutritional management as well. Getting you to have a long life expectancy, but a healthy life expectancy. So nutrition, the work that I do with nutrition is definitely looking at how can we improve on your life expectancy, improve on the healthy life expectancy, but also addressing the health inequalities linked to the lack of nutrition service provision. And this program is basically also contributing to reducing that, the health inequality and improving your access to nutrition and nutrition information. And all of this cumulatively is to improve your health outcomes. So when we think about sickle cell disorder, and you will probably know this information already, but it's so important that sickle cell disorder is a multi-organ and system condition. And so you've got many and all of the systems and organs of the body that are affected, because sickle cell disorder is a blood disorder. And so this slide was actually included in a paper that I wrote, an article that I wrote on the nutritional implications of sickle cell disease. And this is to identify that, the systems and the organs of the body not only affect the medical problems and the experiences that you have, but these problems that you have in relation to your organs and systems can also affect your nutritional needs. And it's important that you understand that as well. So that's why I've included this slide. And so from those things that I mentioned, the fact that it affects your organs, it affects your systems, all of those things cumulatively can increase your morbidity. So that's how the sickle cell affects your health and overall well-being. It can increase your risk of mortality. So we've already seen and heard in the newspaper of sickle cell patients dying very young. It can increase your risk of disability, particularly those patients with avascular necrosis that affects their joints. So we've seen that as a real problem, but also that it impacts on your quality, your overall quality of life outcomes. And again, it's important that we recognize this in the context of the medical, but also in the context of the nutritional needs of sickle patients. I always like to include this following slide, showing how sickle cell nutrition links to the clinical features of sickle cell, because many people don't actually know how nutrition links to sickle cell disorder. And this slide basically highlights the three main clinical features that you may already know about sickle cell disorder. And the first one is chronic hemolysis, and that is basically the rapid breakdown of red blood cells. So we know that under hypoxic conditions, the hemoglobin part of your red blood cell is affected. It becomes stiff and rigid, changes shape, and that also results in this ongoing breakdown of your red blood cells. And normally a red blood cell will have a half-life of 120 days. In sickle cell, that's reduced down to between 16 and 31 days. And so you can see your body has to be making more red blood cells on an ongoing basis. And that in itself has nutritional implications for you. So in terms of chronic anemia and fatigue, increased red cell turnover. As I said, your red cells break down really quickly. That can also impact on your cardiac function, how your heart functions, you're pumping the blood around the body. It can increase something called oxidative stress, which is the abnormal substances that can cause cell damage. And all of this together can result in chronic inflammation. So in addition to that, the vaso-occlusion, which is the medical term for your sickle cell crisis, and this can result in the blockage of small and large blood vessels. This can result in ischemia, which is reduction of blood flow, but also infarction, which is the blockage of blood flow, through the body. And this can in turn cause tissue damage, organ damage, and also result in chronic inflammation. And then the third one I like to highlight, which is the impaired immunity. So for some sickle patients, their spleen has already been removed, their spleen doesn't work as well, and that can increase your risk of infection. And infection can also increase your risk of malnutrition, and by increasing your nutritional requirements. And so by just highlighting these three main clinical features, we can already build up the picture of how sickle cell nutrition is linked to sickle cell disorder. But there's a gap. And my research has identified this gap. So we know now from what I've already explained to you that the clinical features of sickle cell disorder, those three things I've mentioned, responsible for the nutritional implications. But currently what we do have is a lack of nutrition service provision. And the work that I'm doing with my nonprofit organization, Sickle Cell Nutrition Academy, and working with organizations like the Red Cell Network and others, is to help improve and tackle and bridge this nutritional gap. The other thing to remember that when we're thinking about sickle cell nutrition, it is complex. It's not just about nutrition. There are other factors that can also increase your nutritional risks when you're living with sickle cell disorder. And that can be your medical considerations, which we've already touched on, the chronic hemolysis, the vaso-occlusion, the impaired immunity. But there are other factors such as the psychosocial factors. And we know that patients living with sickle cell disorder can suffer with anxiety, with what's the other thing? Depression, and also low mood. So those factors can also impact on the nutrition behaviors, the food choices that you make. So we have to acknowledge that. But there are other factors called the wider determinants of health. So having access to education, having access to health care, having access to support networks, and health, etc., on a wider scale. All of those factors together can have a contribution to how complex sickle cell nutrition is. And when we as dietitians look at your nutritional needs, we will certainly be looking at all of those factors. And I actually also wrote an article about this that's available on a link that's available on the Sickle Cell Nutrition Academy website if you were interested in reading that article as well. So what I also like to highlight in terms of the complexity of sickle cell nutrition is that there are multiple signs and symptoms that's associated with your sickle cell disorder. And the next slide will be looking at those. So you will identify a number of slides or factors already, or signs and symptoms that you may personally be experiencing. And I've highlighted the top three: delayed growth, delayed puberty, and infection risk, because these are predominantly highlighted in the research that looks on the role of nutrition. But things like chronic anemia, fatigue, as I mentioned already, your crisis, retinopathy, so eye health is also important when you're thinking about nutrition and what you choose to help improve your eye health or keep your eye health, eyes as healthy as possible. When you have avascular necrosis, respiratory complications, so things like symptoms like acute chest syndrome, which we also know is, quite a serious and one of the leading causes of death in sickle cell disorder. Patients living with leg ulcers, so needing support with wound healing. Patients who have had stroke, and we're looking at the young patients, but also the older ones. We've already mentioned that sickle is a multi-organ and system condition, and so therefore multi-organ system failures might also contribute to your sickle cell nutrition needs. Those living with pulmonary hypertension can increase your nutritional requirements. People with renal problems. I'm currently seeing a patient that has renal nephropathy associated with his sickle cell. So you can see that there's a breadth of signs and symptoms that's linked to your sickle cell disorder that can have an effect on your sickle cell nutrition. And therefore, it's important that we look and recognize the complexity of sickle cell nutrition. All of those things together work to, add to the nutritional impact of sickle cell nutrition. And this slide highlights some of those that I've already touched on, in previous slides. So specifically looking at high resting energy expenditure. And all that means is that your body, even at rest, as you're resting, listening to this presentation now, may already be using a lot of energy just to do that. So for many patients, they can have what's called this high resting energy expenditure. You can have high protein and red cell turnover, which I've already mentioned, because of this chronic hemolysis, this ongoing rapid breakdown of your red blood cells. This can have an impact on your heart, so increase how hard your heart has to work to pump the blood around the body. We've already touched on the impaired immunity and that impact on your increased risk of infection. Some of you may have a low body mass index, and also I've already mentioned this impact on the oxidative stress that can result in this chronic inflammation. So we know that sickle cell disorder is associated with this ongoing chronic inflammation that can impact on your sickle cell nutrition and your nutritional needs. So we also know that there currently does not exist sickle cell specific RDAs or recommended dietary allowances. So research is needed to look at those, but also more research in general is needed to look at how do we manage these nutritional needs of sickle cell patients. So what are the nutrition deficiencies associated with sickle cell disorder? And it affects both your macronutrients, so your carbohydrates in your fat, so the energy, the main energy producing nutrients in the body, as I mentioned. And so when we're looking at calculating or working out energy requirements, we would be looking at that. And also how your disease impacts your nutritional burden. We'd also be looking at your protein, because we know that there's this increased protein turnover, so you will have increased protein requirements. And we also know that living with sickle cell disorder, you do have increased fluid requirements, and we know that dehydration is a recognized trigger for sickle cell crisis. So looking at the micronutrients, and again, there's a breadth of both vitamins and minerals that can be deficient in sickle cell disorder. So zinc, selenium, vitamin D, your antioxidants, vitamin A, C, and E, your B vitamins, and I'll touch on this again in a couple of slides down the line, but also iron, especially in the absence of iron overload, and also nutrients such as omega-3 fatty acids. So Just from this slide, we can see that there's a number of nutrient deficiencies associated with sickle cell nutrition that's linked to the clinical features of your condition. So what we've also seen, and over the last 10 years, as I said, as I've been learning more about sickle cell nutrition, I've identified a number of common nutritional problems that patients will experience, and malnutrition is one of those things, and we'll say a little bit more about malnutrition in a minute. Anemia and fatigue, we know that there's research that showed that 90% of 1,000 patients globally, as part of this research, identified fatigue as one of the most common symptoms that patients experience. Impaired immunity, we've touched on that already. Chronic inflammation is a common problem. Dehydration and constipation, and particularly in the context of your pain relief, your opioid medication that you will take in terms of managing your pain. Iron overloading, again, is one of the common questions I get asked when I do talks, with patients and support groups. Osteoporosis may not be one of the ones that you've heard commonly, but actually there are patients, and as part of my research project, one of the patients was diagnosed very late in her life with osteoporosis. So we do need to look at that as well. And then something that you may not have heard in the context of sickle cell is this increased risk of cardiovascular disease because you have higher cholesterol levels. And we touch on this in a little while as well. The thing to also remember that sickle cell nutrition affects patients across the life course. It's not just pediatrics, it's not just adolescents. Most of the research essentially has been focused on pediatrics and adolescents, but the adult patients, remembering that this information that I've highlighted over the last sort of 10 years, basically, the adult patients may not have had access to this. And so we do have adult patients that now live with these common nutritional problems. And so we have to focus on the adults. We have to focus on our patients that are aging and now, in addition to the sickle related problems, are living with, problems associated with aging, frailty, pregnancy. So there's a range of nutritional problems that we do need to identify across the life course. So that's the end of part one, and I hope that you've already been able to glean some helpful information from just that one section. So we'll move on to part two, which is now the introduction and overview of the Sickle Cell Nutrition Eat Well Guide, which I'm very proud about. So we started by asking the question, why is good nutrition important? And again, many of you will have asked yourself this question and would have done research on this, but I'll talk you through why good nutrition is important. And this again is something that haven't really been sort of considered in the context of sickle cell nutrition. But good nutrition is important because we need to help you build a good nutritional status. And a good nutritional status, very simply, is about eating a balanced diet. And again, as I said, there'll be lots of information to come that will give you more information about what that looks like when you're living with sickle cell disorder. So it's eating a balanced diet. It is eating the right amounts of foods. Yeah, so it's not just eating anything, it's eating the right amounts of foods, both the quality of what you're choosing and the quantity, and important, factoring in your cultural foods and preferences, because we know that many patients living with sickle cell disorder come from different ethnic backgrounds, African, Afro-Caribbean, Asian, Middle Eastern, etc. So we have to factor that in. Importantly as well, choosing and eating the right variety of foods, because there's no good just having sort of certain foods, but you don't have the right variety, because not one food has all the nutrients the body needs. So you do need to eat the variety of foods to meet your body's individual nutritional needs. I was reminded during my research by one of the participants saying that sickle cell disorder, affects people in very different ways. And we know from that slide I had in the signs and symptoms, not everybody will have all the signs and symptoms. And so we do need to tailor the advice that we give, to the individual patient. And this is so that you can, your specific body can function as optimally as possible. And when we do that, hopefully you can enjoy a good quality of life and you can do the things that you enjoy doing. But it's all about building this good nutritional status. So how do we know that you have a good nutritional status? What are we looking for, particularly, from a dietetic perspective when we're doing a nutritional assessment? So we would be looking at your diet. So we'll be taking a diet history. So a healthy, balanced diet is definitely the starting point and is important. But we'll be also looking at anthropometrical measurements. And what that means is we'll be looking at or anthropometry is looking at the measurements in relation to your size, the proportion, and the body composition. And some of those measurements that we look at includes weight, your height, and body mass index or your BMI. And it's interesting that of the patients that I have spoken to, when I've asked them, what is your weight? Many patients don't know what their weight is. They don't know what their height is. And so I want to encourage you, if you don't know that you either go to your GP and get it assessed, or if you've got those, facilities at the pharmacy, then by all means do that so that you can calculate your BMI. And the next slide will show you how to calculate that. And there's a link online as well that you can look at to help you do that. But we also look at weight loss. Particularly unintentional weight loss. So weight loss, not because you're trying to lose weight loss because you're eating, but your body's not getting enough. And as a consequence of that, you're losing weight, but also weight gain. For some patients, they may be gaining weight. And again, when we're looking at weight gain, is it because of diet? Is it because you're retaining weight? Is your skin puffy? Have you got fluid building up in your ankles and all of those things? So we'd be looking at that. But also we know now, because of the slides I've already gone through, that sickle cell disorder is associated with chronic inflammation. So we'll be looking at your blood levels, your biochemistry as well, your inflammatory markers there. And also we'll be looking at how does sickle cell, what's the burden? What's the disease burden for you in relation to the signs and the symptoms that you have, specifically the complications that you have in relation to sickle cell disorder. And so we'll be looking at all of those factors in terms of assessing your nutritional status. And so, as I mentioned, this next slide is just for those people who don't know how to calculate your BMI, your body mass index. So essentially, what your BMI, the information that we get from our BMI is just your a healthy weight, assessing whether you have a healthy weight. And that we calculate by knowing your weight. So it's important, as I mentioned earlier, that you know how much you weigh, your height. So, and that's your height squared. And that means, for argument's sake, I've given the example there. If your weight is 70 kilograms and your height is 1.68 meters. So to calculate your height squared is just your 1.68 times itself. So 1.68 times 1.68, and you'll get a number there. So to calculate your BMI is your weight divided by this number that you get by squaring your height. And the example that I've given here is that person's BMI will be 24.8. And so one thing to remember as well, and again, if you look at the NHS website, it will give you information about the BMI categories. So if you are from an African Caribbean or ethnic minority backgrounds, that number for your BMI is slightly lower than for Caucasians. So it will be 23 as the upper sort of BMI limit. So just to be aware of that. And for Caucasians, that will be a BMI of 25. But as I said, if you go onto this website that I've included at the bottom of the slide, you'll be able to work out your BMI, body mass index, but also you can then look at what those weight categories are. And essentially all that is to give us an indication of, do you have a healthy weight? Where are you? Are you overweight? Are you underweight? And then that informs us to the strategy that, in terms of nutritional assessment and the interventions and how best we can support that for you. So I've already mentioned malnutrition as one of those common sort of problems that is associated with sickle cell disorder. So what is malnutrition? And I've listed a couple of things here, and you will see that it relates to healthy eating very much. because it's about the nutrients, both the macro, the nutrients, but also the small nutrients, the vitamins and the minerals related to what you're eating. And so what is malnutrition? It is not eating enough of the right kinds of foods. It's not eating enough of the right amounts of those foods, not eating the right variety of those foods and those nutrients that you can get from the foods that you eat, but also not meeting the body's nutritional needs. And so when you don't do that, that increases your risk of malnutrition because you are now not having the nutrients that your body needs to ensure a good nutritional status and also ensure a good health and well-being. So malnutrition is caused by an imbalance then of those essential nutrients needed to keep you healthy, energized, and strong. But there can also be other sickle cell related factors that can increase your risk for malnutrition. And that can be things like I've already mentioned earlier on, psychosocial factors. So, if you're feeling depressed or you're living with anxiety or you're feeling stressed, that can affect your appetite, what you choose to eat, when you choose to eat, and all of those things can also then impact on your malnutrition risk. And so we need to consider that as well. So this next slide now is something that I thought I'd include because we mentioned about when we think looking at health, we're looking also at having a healthy life expectancy, not just increasing our life expectancy, but having a healthy life expectancy. I don't know if you guys have come across the blue zone principles, and this is the blue zone principles that was sort of identified or founded by someone called Dan Buettner, who looked at a number of countries where they had the highest amounts of centenarians, people living 100 years and older, and he studied their lifestyle and their diet behaviors and identified these 9 principles that have contributed to them being able to live long, but also live healthy. And I was wondering if you could in the chat, I won't be able to see it just now, but I will check later on to see what you've come up with. If you've heard of this, do you know what they are?
I'm gonna get my pass.
Can you just?
I'm gonna get my pass. Why?
Can you just make sure that you muted? Thank you so much. So I have listed the first 3 for you. So if you know, please put it in the chat. But also, if you don't know, I would highly recommend that you go away and have a look. And I will tell you what the other 6 is at the end of the presentation. So the first one is all about moving naturally. We know that with living with sickle cell disorder, the advice sometimes around movement and activity and exercise can be such that, you have to limit that because it can bring on a sickle cell crisis. But, it's interesting looking at ways of how you can move naturally without triggering a sickle cell crisis. The second one is having a purpose, having a reason for living. So I think that's really important that and have a purpose for reading. And that's why I included the image in this slide, the students graduating. Is that something that you think that you want to do or have a desire to do? So maybe thinking about that and what do you need to get you to that point. And the third one is downshift, and this is all about stress. We know that stress is linked to inflammation, and we know with sickle cell disorder, high levels of inflammation. So we want to look at what do we need to do to try and reduce the stress that we're exposed to. And again, the image on the top there is about, do you like dancing? What do you enjoy doing? And certainly in terms of how do you relax and how you can reduce your your stress factors. So as I said, I'm going to give you the other 6 at the end of the presentation, but hopefully you'll do some research yourself and you can look at what these principles are and read a bit more around it. So now we're going to move on to why healthy eating is important, because I said a lot about, the importance of eating a healthy, balanced diet. And so now we want to we want to fine tune that a little bit more by looking at why healthy eating is important. And eating is that important that the World Health Organization actually recommends and calls us to consider healthy eating, but also recognizes that healthy eating isn't all that simple. It is complex, and it does evolve because there's so many factors that come into play when we're thinking about healthy eating, and one of those things that come to mind now for me is just the cost of living crisis that we're living with at the moment. The money that we have to be able to buy, good choices of food. Where do we buy these foods, etc.? So we know that it's not as straightforward, but it is important. And so we do need to look at, how we can achieve that with the resources that we do have. And, it's important that a healthy diet is, as I've already mentioned, to help protect and prevent you from developing or becoming malnourished. We've already identified the risks, for related and linked to sickle cell nutrition. And so a healthy diet and healthy eating is definitely important in a general population context, but certainly in a sickle cell disorder context, and also to prevent you from developing non-communicable I can never say this word, non-communicable diseases, or other words, diseases of lifestyle. And so that's sort of why it's important. The World Health Organization has gone on to give us some guidance, again, to think about, what does that look like for us? What does healthy eating look like just generally? And as I said, as we go through the presentation, you'll see it will be tailored towards sickle cell nutrition. It is about energy balance, and energy is just the amount of food that you take in your diet. And does that match with the amount of energy that you use, the activity that you spend? And that's really important because we can lose weight if we take in less than what our body needs, or we can gain weight if we take in more than what our body needs. So that energy balance is an important factor and guideline to consider. Choosing healthier fats, and we look at that in a little bit more detail. So for all of us, but certainly in the context of sickle cell disorder, and we've already seen that cardiovascular risk is a common risk for sickle cell disorder, patients living with sickle cell disorder. So we have to look at choosing healthier fats. Looking at processed foods or high processed foods. And so particularly those foods will have high levels of sugar, high levels of salt. So we want to look at reducing those foods in our diet, and specifically looking at your 5 a day, your 5 portions of fruits and veg a day. And again, interestingly, looking at asking you in the chat, who of you, there's a lot of you online, 58, so welcome. If I didn't welcome you, those who joined later on, I'm hoping that you enjoying the session so far. Put in the chat, are you eating your 5 a day? Are you eating 1 a day or 2 a day? And hopefully at the end of this presentation, that will increase so that you can have your 5 a day. But that's why we need to be eating a healthy diet. So just again to show that the Eat Well guide, if I just go back to the previous one, this one is the original Eat Well guide that was developed, and people have adapted the Eat Well guide. So in this example, we've got a vegan Eat Well guide. So for those of you who follow a vegan eating pattern, so do check that one out as well. There's also a South Asian Eat Well guide. So that it has been developed for different sort of conditions or ethnic groups. But I'm really proud to introduce the first ever Sickle Cell Nutrition Eat Well Guide. And I know that there will be some of you in the audience listening who would have been part of the NHS England project where we were looking at developing this Eat Well guide. So thank you to those in the audience who've been part of that project. And this is the impact of your work. We've been able to develop the first ever Sickle Cell Nutrition Eat Well guide. And what's really good about this is that we have been able to tailor it to the cultural foods from the African and African Caribbean populations. So hopefully you'll be able to identify some of the foods that's already in your normal eating pattern. But what's brilliant about the Eat Well Guide as well, which is different from the others that I've just shown you, is that we've included key messages, nutritional messages related to the common nutritional problems that patients can experience. So if you're looking just very briefly at the orange group, for example, and we'll go through this in a bit more detail, you'll see the little message there is include energy boosting foods. So not only will you get examples of the foods that you need to be including, that reflects your traditional foods. You'll also get messages that relates to some of the nutritional needs that you may have. So I'm really proud of this. If you don't already have your copy, do go on the Sickle Cell Nutrition Academy website, the compendium, and you can download your copy there. So the Eat Well Guide is made up of 5 food groups, and very briefly, it's the carbohydrates, which is the yellow group. And again, I'm not going to go into too much detail because the next couple of slides will be breaking down the Eat Well Guide sort of clearly, so you can see that. So just to say, there's the carbohydrate group, so the energy foods, so starches, bread, cereals, potatoes, rice, pasta. Your green group is the fruits and vegetables. Your pink group will be proteins, beans, pulses, meats, and other proteins. The dairy is the blue group, which is your dairy and milk alternatives, cheese and yogurt, and also the purple group, which is that little slither there, but it's all about your fats and oils. So now the next couple of slides will be talking you through those specific segments and the foods related to that. So you've got a bit more detail to work with. And so this first segment is highlighting your starchy carbohydrates and your whole grains. So you can see there examples in the segment there. You've got your breads, you've got your hard dough as an example, you've got your green banana, you've got cornmeal. But importantly to remember, and you'll see in the next slides, is when we are choosing foods from this group, is to make sure that we're choosing options that have whole grains or higher fiber content that's less processed, because that is going to give you the best nutritional sort of benefit from those foods. And the other group to highlight in terms of your energy foods is your fats and oils. And again, choosing healthier fats and oils is important. So just looking at carbohydrates specifically, key nutrients and functions, it is a very important source of energy for all body function, particularly the brain. The brain needs the glucose from the carbohydrates. Once it's digested, it needs the glucose to function well. And so it is an important part of the diet in terms of the brain, as I said, the central nervous system, how the muscles work, as well as digestion. And as I mentioned in the previous slide, choosing complex unrefined carbohydrates is your better choice. Having fruits and vegetables and that will definitely help to increase your fiber content, and also make sure that you're choosing the no added sugar options in this particular food group. So fats, again, very important. All these nutrients perform important functions in the body, and particularly in regards to fats, they are the carriers of our fat-soluble vitamins, vitamins A, vitamin D, E, and K, that's made in the liver, but also it helps with the absorption of these fat-soluble vitamins. Insulation is another important function of fats, but you'll see there's so many other functions that we will touch on in a few slides to come. So then the fruits and vegetables, as I said, your 5 a day is really important. And again, it gives you examples from your traditional and ethnic foods, and hopefully you can identify some of the foods in there. But again, highlighted in this group is the importance of regulating the immunity and including antioxidant foods to reduce the inflammation. So you're getting your message there as well. So when you're looking at your fruits and vegetables, this section will provide vitamins and minerals. So in this slide, we'll focus on the vitamins, and that's important for proper growth, maintenance of health, and prevention of disease. But also remembering that vitamins and minerals, they are known essential nutrients, and that means that the body can't make it. So you have to eat well so that you can ensure that your body gets the vitamins and minerals from the food that you eat in your diet. Looking at the protein and plant alternatives, again, you can see there, you've got your fish, example, salmon, you've got eggs, you've also got your chickpeas, lentils, your legumes, because I know many of you or some of you will be following a vegetarian or a vegan sort of eating pattern. So it's important that within that you still choose good options so that you can get the nutrients that you need. And what's important about protein and plant alternatives? So protein is also one of the most important nutrients to maintain good health and vitality. It's important for growth, repair, and development. But importantly, it's part of all the tissues of the body, the bones, the nerves, the skins, hormones. And one thing to highlight about proteins, it is protein sparing. So if you don't eat enough of your energy foods that I've already mentioned, your carbohydrates and your proteins, the body will actually start breaking down your protein in your muscle for energy. And so it's important that we not only have enough protein, but we also have enough of the energy foods to prevent the body from using your muscle as a source of energy. So dairy and dairy alternatives, again, the important message there is improving your bone health, and that is to reduce your risk of osteoporosis. And looking at dairy and dairy alternatives, importantly, I'm highlighting minerals because the important mineral from the dairy foods is, put it in the chat, calcium. It's a catalyst for many biological processes. And again, I've listed that: muscle response, digestion, metabolism, and it coexists with vitamins. And so we do need that 5 a day so that we can get the vitamins and minerals because they work together. And it's important for many physiological processes, as I've mentioned there, in terms of, if you're thinking about calcium specifically, bones, building bones and teeth. A mineral like magnesium is important for controlling blood sugar levels, and also normal muscle function. So we can see they provide important functions in the body. So in additionally, the Eat Well Guide also highlights these 3 health principles. So we know, because you would have been given this information for your entire life living with sickle cell disorder, drink enough fluids, and drink enough fluids to prevent dehydration. And so the recommendation is to drink 8 to 10, but again, depending on other factors, it could be that if you're ill, you need more. If you, if the weather's warmer, you need more. So that's just a guide. So, it's important that you drink enough fluid, as I've identified there. Eating less of the processed foods that contain high fat and sugar, as I mentioned earlier on, and eating this in small amounts. So we're not saying you can't have, but we're saying that you eat this less often and that you have small amounts. It's definitely treats, and not to be eaten on a regular basis, because basically the nutrients you will get there will be energy, but it'll be energy with very little nutrient content. And so the other thing to highlight is the traffic light system. So most of the foods you will see in the supermarkets will have this. So I will encourage you, if you don't, pick up a food and just look at it. Try to find foods that has more greens and ambers than reds, because red means it has higher levels of either sugar, salt, fat, or even energy. And so it's just to highlight that so that you can make healthier food choices as well. I'm just going to check the time where we are, so that we can get in all the information. Right. Good. So just to add to what I've mentioned in this last slide, so water, we know that our body is made up of over 70% of water, and it's essential for all of those physiological processes that I've highlighted already. Fiber, it's an interesting one as well. We need that in terms of constipation. We know that constipation is a common problem when you're living with sickle cell disorder, particularly. It's a common side effect of the pain medication that you have. And so fiber is important in terms of keeping your digestive system healthy, but also reducing and preventing you from, developing constipation or having the effects of constipation. Also choosing healthy dietary choices, as I've already mentioned, that is to help maintain a healthy weight. And we do know from research and from other health conditions that having a healthy weight, definitely improves and reduces your risk of other sort of conditions, that can negatively impact your health and well-being. So this slide I've highlighted, I've included, is just to say, and I think I've mentioned this already, that when we're looking at the healthy eating and we're looking at the healthy balanced diet, it's important that we do tailor it to the nutrition advice to the cultural foods and diet preferences of patients. And so that is definitely something that I have taken on board, and that we do need to highlight, that is important for our patients, so that we can tailor the advice and support that you're given to, your traditional diets that you may be following. So that's the end of part 2, which is the introduction to the Eat Well Guide. And I hope that you, along with me, are very happy that we now have a Sickle Cell Nutrition Eat Well Guide that is tailored to your specific sickle cell disorder, your nutritional needs. I see a hand. Laurel, there's a hand. Oh, there's a thumbs up. Great. Thank you, Laurel. That's fantastic. And hopefully, as I said, going through the slides would have given you a little bit more insight into the importance of tailoring the nutrition advice and support for patients. Laurel, your hand is up. Did you have a question? Maybe just put it in the chat. And hopefully at the end we can try and get to that as well, if that's okay. Right. So we'll move on to part 3, which is now the introduction to the nutritional implications in sickle cell disorder. So this is getting down into the nitty-gritty of nutrition, the nutritional implications that's linked to sickle cell. So the first of the ones I want to highlight, and as I said, I've mentioned this already, is the need to increase the protein and energy intake, which we've also identified and highlighted in the Eat Well Guide. And here, why that is important and how that comes about is looking back to those nutritional problems that we identified when we looked at those 3 clinical features, the chronic hemolysis, the vaso-occlusion, and the impaired immunity. So we know from those clinical problems that sickle cell patients do have a higher resting energy expenditure, i.e. you use more energy even at rest for many patients. And that can result in this, what's known as hypermetabolism. So the body uses more energy for normal physiological functions, but also burns up more food and more energy much quicker than normal. That means you then need to have more of the energy, the foods that provide and increase the energy in your diet. And we come to that in a minute. So we also know that this high resting energy expenditure linked to the chronic hemolysis increases how hard the heart has to work to pump the blood around the body. And that's to do with for many of you, you will have lower hemoglobin levels. And again, I always ask patients, what is your hemoglobin level? And many patients don't know what their baseline hemoglobin level is. So if you don't know what your baseline hemoglobin level is, please find out, because it's really important for you to know that information. But coming back to this is, with the lower hemoglobin level, there'll be less oxygen to perfuse the cells and the tissues of the body, and also the heart just has to work so much harder to pump blood around the body, and that means also you will need more energy and foods that provide the body with more energy. And we also mentioned that increased protein turnover, particularly in regards to your body needing to make more red blood cells, and also this ongoing repair and building that when you're living with sickle cell disorder. So it's important that you take in enough of the protein to almost compensate, and that you have enough protein there so the body can actually do what it's needed in terms of growth, in terms of development, etc. And so what are the nutrients then that you need to take to ensure that you have adequate and enough energy and protein in your diet. So foods that I've already mentioned that's important are your carbohydrates and your fats. So I want to take your mind back to the yellow group that we went through in the Sickle Cell Eat Well guide, and also the purple group, which is the fats and the oils. So make sure that you're choosing a good variety and the right amount of those foods from the carbohydrates group as well as the fats and oils group. And in terms of protein, so making sure that you're taking enough protein food. So that will be your pink group that I mentioned. And that will be food from animal products, but also plant-based products. We had examples there of legumes, of chickpeas, of beans, also nuts and seeds, etc. But also dairy foods contains protein. So making sure that you're taking in a good amount of dairy foods, because that can also add to the protein intake in your body. So when we're looking at carbohydrates, looking at the nutrients specifically in terms of carbohydrates, and we look at fats next, we've already identified the function, there's important functions in the body. We've said that the brain needs the glucose that we get from the carbohydrates, the brain, the central nervous system, muscles, etc. But also fats are required for carbohydrate breakdown. So, we do need to get a good amounts of fats as well. And particularly it's recommended at least 100 grams of carbohydrates daily in your diet. I know people will or may have gone on keto diets, etc., or thinking about that. And so it's just bearing in mind when you are following those diet variations, the importance of the nutrients that we get and the functions of those foods as well. And if you are following a low carbohydrate diet, so maybe you're doing a keto diet, you do need to take more water to help the kidneys work better. And if you don't, that can also lead to kidney stones, which is very painful. I've not had, but I've heard from people very painful. So when we're thinking about carbohydrate sources, as I mentioned earlier, you want to go with the complex carbohydrates, so the ones that are less processed. So foods that contains so grains like rice. So thinking about brown rice, for example, wheat, oats, barley, your fruits and your vegetables, as I've mentioned earlier on. If you are having refined carbohydrates, be very mindful, particularly if you live with diabetes, that can cause a sharp rise in your blood sugar levels. And so we want to try and reduce the intake of refined carbohydrates. And examples of that would be your sweets, chocolates. If you're having sugary, fizzy drinks, cakes, etc., we want to reduce that. Just because, again, the nutrient you're getting there is more energy, and it's not going to give you the vitamins and minerals that you need in terms of good health to ensure that you have a really good nutritional status. So key vitamins from the carbohydrates is B vitamins, so thiamine, niacin, riboflavin, your folic acid, fiber, and energy. So this slide is just to give you some visuals of what whole grain carbohydrates might look like. You've got your oats, you've got your different grains there as well. Pasta, go for wholemeal pasta, go for brown rice, etc. Sugar, remember, again, you can have sugar, but just looking at this image there. So if you're 11 years and older, no more than 30 grams of sugar, and that's equivalent to 7 cubes of sugar. So you want to definitely pay attention to reduce the amount of sugar in the diet. Yeah. So now we need to move on. And so moving on, looking at the fats, as I said, we've already looked at the important functions of fats, but also to know that there's different classes of fats. There's triglycerides, phospholipids, and sterols. So sterols, example is cholesterol. And again, if we just take your mind back to the slide we spoke about, the guidelines that the World Health Organization gave, and that is to choose healthier fats. So we want to choose healthier fats, and that's more choosing polyunsaturated and monounsaturated fats. Examples of these would be your omega-3 fatty acids, and this we know reduces the chronic inflammation. but also is important for brain health as well as heart health. So there's important functions, and benefits of having omega-3 fatty acids. So examples there: sardines, tuna, salmon, mackerel. Some people will have fish oil, cod liver oil because they don't like fish. But there's also plant sources, flax seeds, chia seeds, walnut oil, canola oil. So all those will also provide omega-3 fatty acids. And your monounsaturated fatty acids examples there would be olive oil, avocado, nuts and seeds. And the fats to reduce intake of is your saturated fat. So this is predominantly from animal products, and this will increase your what's known as your bad cholesterol, your LDL cholesterol. And so examples of those foods, as I said, animal products. So if you're having lamb or beef or what's the other one, pork, those foods definitely will contain saturated fat. They will increase the cholesterol level as well, but also deli foods, sausages, pies, and different types of oils. So palm oil, coconut oil, ghee and cheese, all of those types of foods contain saturated fat. So you do want to pay attention as to what types of fats you're using, how much you're having, because that can impact your overall health and well-being. I'm going to speed up a little bit so I'm just going to go back. So in terms of protein intake, so, just looking at other functions of protein, so they can be hormones, like insulin, growth hormones, hormones involved in sexual development and also metabolism. It's important in terms of regulating the body's water balance. It's important because the body can, when you have surgery, you can lose protein. When you bleed, you can lose protein. Also, if you're living with long-term illnesses, you can lose protein. So that will certainly with sickle cell disorder as well. So that will increase your need for proteins in your diet. Importantly, it's needed for rebuilding and replacing tissues. And we've seen that in terms of chronic protein turnover and also red cell turnover with regards to the chronic hemolysis. And good sources of protein will be ones that contains all the essential amino acids, and predominantly that will come from heme, so animal products. So it is finding that balance to ensure that you get the nutrients that you need for good health, but also in the right amounts that doesn't sort of exacerbate any risks for you as well. So this slide again is just examples, visual examples. So we've got fish. I think that might be salmon, but it may be something else. Eggs, again, your legumes, your beans, chickpeas. And for those people who do have animal products, those are examples. If you're following a vegan or vegetarian diet, so having soya protein, so tofu, which is from soya milk that's been coagulated. So tofu is a good example there. Tempeh, using the soya bean, fermented soya beans, but also nuts and seeds is important as well, or good sources. So how do we increase our vitamin and mineral intake to improve our impaired immunity? Specifically, we want to look at the chronic inflammation that we've already identified. And chronic inflammation, just to highlight, is a consequence of the infection risk associated with sickle cell disorder, but also iron overloading. If you do experience iron overloading, that can also increase your inflammation. So nutrients that are important there are vitamins, particularly your antioxidant-rich vitamins, such as your vitamin A, C, and E. Vitamin D is important. Folic acid is important, as well as vitamin B12. If you're thinking about minerals, that's in relation to sickle cell disorder. So where there's deficiency, so thinking about zinc, selenium, calcium, magnesium. And then in terms of anti-inflammatory foods, we've already identified omega-3 fatty acids in terms of your fatty fish, but also plant sources. Thinking about turmeric, leafy greens, dark chocolate, if you enjoy that, broccoli and bananas. So all of these foods can definitely help towards reducing this inflammation that's associated with sickle cell disorder. We've already mentioned antioxidants, and your vitamins A, C, and E are examples. And again, iron, but in the context of the absence of iron overloading. So vitamins, we've identified the importance of vitamins. So I'm going to just highlight in this slide the sources. So importantly, thinking about your water-soluble vitamins, because you do, in terms of vitamins, you get fat-soluble vitamins, but you also get water-soluble vitamins. And your B vitamins, your B complex vitamins, so thiamine, niacin, riboflavin, your folic acid, pyridoxine, B12, all of those are your water-soluble vitamins, including bioflavonoids that you find in legumes, citrus foods, soya beans, grapes, etc. All of those foods, they contribute towards your vitamin intake. And your fat-soluble vitamins, the examples there, vitamin D, E, and K, also beta-carotene. So all your fruits and vegetables, plants that contain red and orange pigmentation, that will provide this beta-carotene. So just some examples there of those foods that I've mentioned already. Just if you're thinking about vitamin A, for example, the beta carotene that we mentioned, so your dark green veg, your yellow and your orange veg, tomatoes, apricots, peaches as an example. Vitamin C will be your citrus, which we know is quite common, broccoli, green leafy veg, also cantaloupe, your berries. Vitamin E, again, avocado. I enjoy avocado with boiled egg as an example. Your grains, your nuts, your seeds. And the thing to remember here, you can see there's a range of foods that provides the vitamins and the minerals that you need in the body. And that speaks to the variety of foods that I mentioned earlier on. There's not one food that will give you all the nutrients that you need. And that's why eating a variety of food is that important. If you're thinking about vitamin D, we know sunlight, but we know we don't always have a lot of sunlight. So example, foods like oily fish, egg yolks, but also fortified foods. But we also know that in terms of sickle cell disorder, the recommendation is that you do take a 10 microgram of vitamin D supplement daily, and that's also equivalent to 400 international units. Other antioxidant foods, just to mention, there are foods and spices like cloves, olive oil, nutmeg, cumin, garlic and ginger, spinach, chili peppers, avocado. So there's a range of other foods that can also improve or serve as antioxidants in your diet. So if we move on. So nutrients that improve immunity. So in terms of minerals, and again, I'm just going to run through this because at time, we want to try and keep on time. So in terms of functions of minerals, they are important for your overall mental, physical well-being. They form part of lots of tissues in the body. But they also important in terms of strengthening skeletal structures. And we know that, if you're living with a vascular necrosis or you're at increased risk of osteoporosis, you do want to ensure that you get in, particularly your calcium, your vitamin D, to ensure that you can have those strong bones and reduce your risk of osteoporosis, for example. It's important in terms of muscle and nerve functions, but also in terms of water balance. So there's a range of nutrients and functions in terms of minerals. So what are those examples? Again, looking at zinc, for example, pecan nuts, black-eyed peas, eggs, fish, poultry, herring, oysters. For example, selenium, Brazil nuts. The recommendation is no more than 5 Brazil nuts a day because that can add to selenium toxicity. So you want to have Brazil nuts, but not have a whole bag. You want to limit that. Other foods in terms of selenium sources, tuna, herring, oysters. So if you are vegetarian and you are or vegan, then it may be that you need to consider having a supplement to provide these nutrients if you don't have the foods that I've mentioned here. And other minerals to consider: magnesium, as I mentioned, also has a function in terms of controlling blood glucose levels, but also muscle function. So things like nuts, whole grains, beans, dairy products, meat, fish, as an example. Dehydration and constipation. We know that dehydration is a risk factor for sickle cell crisis. So we do want to pay attention to reducing your risk of dehydration. And again, with the Eat Well guide, we actually highlighted that on there as well. But thinking about the fiber aspect in terms of constipation, we haven't said a lot of fiber. We've just said, to choose complex carbohydrates. But fiber is important. It's like the broom of the digestive system to help to keep that digestive system healthy, and also to reduce other complications or conditions like diverticular disease and certain cancers, colon cancer, for example. So we do want to include a good amount of fiber. In terms of fiber, knowing that there's different types of fiber. So you've got the soluble fiber. Examples there is your pectins from oats and beans, apples. And what it does, the soluble fiber, they form a gel when it comes into contact with water and softens the stool, making the movement easier along the digestive tract and also helping you to go regularly. So it's important that you have and include in your diet both examples of soluble fiber, but also insoluble fiber. And in addition, the soluble fiber also helps to reduce cholesterol level, particularly your oats. So thinking about insoluble fiber there, it adds bulk to the stool. And by doing that, it helps to simulate movement of the stool down the digestive tract and therefore can help to prevent constipation. So water, again, you would have heard this messaging about water, throughout your life living with sickle cell disorder. So it is important. We know our body is predominantly made up of fluid, so we do need to drink enough. And it's important for lots of physiological processes, respiration, so breathing, digestion, metabolism, temperature regulation, etc., and also to keep the pressure, the acidity, and composition of chemical products, in balance, so homeostasis. But also, and you may have experienced this yourself, if you don't drink enough or you are hydrated, you may experience headaches. And also they've identified there's an association or a link with dehydration with a chronic joint pain, asthma, and heartburn. So you want to make sure that you take enough water in for all of those reasons, but certainly in the context of sickle, you want to prevent constipation, you want to prevent dehydration and reduce your risk of sickle cell crises. So again, this slide is just to show you examples of high fiber options. So there you've got your fruits and your nuts. There's a good example of a Brazil nut there. You've got your oats. You've got your whole wheat pasta. You've got your wild rice, etc. So you want to ensure that you get a good mix of these whole grain and complex carbohydrate foods. So this slide is just to give you some examples of fiber swaps that you can make very easily. So from low fiber to high fiber. So if you normally have cornflakes for breakfast, maybe thinking of having oats. We've just heard that oats is a type of soluble fiber that also reduces the cholesterol level. So you want to make those swaps. So if it's not oats, it could also be Weetabix or bran flakes. If you're currently having white rice in your diet, you may want to consider having brown rice or wild rice as an example. If you're having biscuits as a snack, you want to consider maybe having unsalted nuts. You're going to get healthy fats from there, but also maybe some fruits to increase your fiber day that we mentioned to get your vitamins and your minerals and your soluble fiber. If you are having, chapatis or rotis, instead of having your white chapati or roti, thinking about having a wholemeal, using wholemeal flour instead, so that you can get your higher fiber intake that we've mentioned. That's important for you. So the last of these sort of slides is looking at managing sickle cell related nutritional problems. And I highlight this because we know that, because I've said this in an earlier slide, the slide with the signs and symptoms related to sickle cell disorder. So complications associated with sickle cell disorder, your increased infection risk, your wound healing, your leg ulcers, your stroke, multi-organ system failure, gastrointestinal problems like nausea, the constipation. Some people can experience vomiting as well. Pulmonary hypertension can increase your nutrient requirements because you have to breathe so much more and harder, so you're using more energy. That will increase your energy, your energy needs. If you've had a cholecystectomy, removal of your gallbladder, all of these things that's directly related to your sickle cell disorder, that can, have an impact and increase your nutritional problems and risks. So when we're thinking about those complications linked to sickle cell disorder, you have to think about the nutrient side of things. So importantly, looking at your micronutrients, as I mentioned earlier, so your carbohydrates, your proteins, and your fats. So again, thinking about your Eat Well guide, where do you get those nutrients from in terms of your Eat Well guide and the 5 food groups that I've mentioned, but also the micronutrients, because we've already now seen with all these slides, there is nutrient deficiencies, low vitamin levels, and low vitamin mineral levels. And when you have these complications, as I said, if they affect your nutritional needs, then it can have an impact on these nutrients as well. And so it's important to factor that in. So this slide, I like to include the slide in presentations because it just highlights the benefits of good nutrition. You've heard a lot. We've spoken a lot about a healthy, balanced diet, and we've looked at what that looks like in regards to the Sickle Cell Eat Well guide, the 5 food groups. We've gone through each of the 5 food groups. We've also now touched on, those main nutrients that you need and that you can be deficient in. And so it's important that we pay attention to good nutrition. And that is also important because we want to improve your nutritional status. Because imagine you can improve your nutritional status by choosing good, choosing healthy options, choosing the right amount of foods, the right variety of foods, the right quality and quantity of those foods. And because you do that on an ongoing basis, you can have the benefit of staying healthier for longer. So remember, we spoke about the life expectancy. So having a longer life expectancy, but also a healthy life expectancy. So helping you to stay healthy for longer. But also if you are on medication, linked to your sickle cell disorder, helping the medication to work better, it may mean that potentially you may have to reduce the dosages of the medications that you have. For example, if you have high blood pressure, for example, it may be that you can reduce, the dosage that you have for those medications because you are now choosing healthier, following a healthy diet, you're making healthier choices, but also you have a better nutritional status overall. Potentially improving the mobility linked to sickle cell, and mobility here reflects links to the complications or the signs and the symptoms that I've mentioned, linked to sickle cell disorder. So by having a healthy nutritional status because you're eating well, that can reduce your risk of the complications or worsening of the complications, potentially reducing the frequency and the intensity of a crisis. That's a real possibility, but it will only become a possibility if you pay attention to doing all the right things in terms of improving your diet so that you can improve your nutritional status, and therefore have the benefit of reducing your overall risk of crisis. If you have to go into hospital because you do have a crisis, we know that good nutrition can help to reduce the length of stay for other conditions. We think of conditions like patients with cystic fibrosis, cancer, etc., etc. And, sickle cell disorder is no different. But if we pay attention to good nutrition and we help to reduce your risk of malnutrition, but we also, pay attention to improving nutritional status, you can, help to reduce your length of stay in hospital as well. Help to reduce your recovery rate. So if you normally have an admission in hospital and you normally stay a week, who knows, by improving your nutritional status, by reducing your risk of malnutrition, that can reduce your recovery time to only having to be in hospital for maybe 2 to 3 days rather than a week or 2 weeks. And I've heard patients say this. Because I've started eating well, my admissions used to be a month and now they're reduced down to a week. So we know that happens. And, so by just making these adjustments, you can definitely, experience the benefit from having a good nutrition and therefore good nutritional status. But as I mentioned earlier as well, reducing the amount of medication to manage your sickle cell disorder. So I've listed a range of benefits, and I really, encourage you to do all that you possibly can. Continue doing if you're already, because I saw Elaine Tappan join earlier on, and I know Elaine's been following, sort of healthy eating for a long time, but I hope that there's many others who are already doing that. But if you're not already doing that, that you would decide, to start doing that so that you can get the benefits that others are having because of good nutrition. So that's the end of part 3, and again, I hope that you've been able to take a few new things, maybe some old things, refreshers, etc., from part 3. So if we go on to part 4, which is the last part of to this evening session, so it's empowerment and lifestyle tips, and this is very important to me, that we look at this and that you go away feeling empowered with the information that you got from this first session, and just be encouraged to do things differently, to add things to your diet, to take things out that needs to be taken out, and I won't forget to give you the 6 remaining principles for the blue zone. So if we start off with, and I like how keywords have been identified here. So take, be, make, keep. So practical words. So take away. Take, be, make, keep, maintain, remember, and ask. So if you start with taking daily positive action to improve your quality of life and health and well-being. Whatever that looks like for you, it may be that you haven't been doing, this blue zone one was moving naturally. You haven't been moving. So maybe that's something that you can consider. What can I do? Can I do chair-based activity? Can I go for a walk? Can I just walk down the road? Or whatever that may be for you. So I want to encourage you to start from today, if you're not already doing that, taking daily positive action to improve your quality of life. Be proactive. Practice daily self-care, whatever that may be. It may be, as I said, your diet, that you haven't really paid attention to your diet, or, there's something else you can add in. Don't wait for the doctor or the nurse or anything like that. Think about, based on what you've learned tonight, if there's anything else that you can do differently. So be proactive with your health, and do something different today. So the next one is make daily good nutritional choices. As I said, one of the first things you can do, if you've not already done it, is to download a copy of the Eat Well guide, and start looking at that. There's a front and a back, because the patients that when we developed it, they wanted more information. So there's more information on the back of the Eat Well guide. But look at that, study each of the groups and see what what are the messages there, what are the things that you can do differently. But decide from today that you're going to do something different, in terms of improving your nutritional intake, balanced diet, but also towards improving your nutritional status. Keep active daily. 30 minutes of activity 5 days a week is what is recommended. And again, if you haven't done activity or you haven't moved before, if you're starting out, that may be 2 minutes for you. It may be 3 or 5 minutes for you, but it's something that you're doing differently. And so again, I will encourage you to consider what that looks like for you. Pace yourself. Don't do too much too soon, because that's not the best way to do it. So decide which days you're going to do it. Am I going to do something on a Monday or on a weekend? But just decide to do something differently. Maintain. And again, with the Blue Zone principles, they highlight, the importance of maintaining good relationships. And so if you are doing this on your own, I would highly recommend either plug yourself into a support group where you can meet other patients living with sickle cell disorder, where you can learn from them. Maybe you can share your experiences, etc. But try not to do this on your own. If you've got any questions, reach out to the HCCs or to your consultants or to your nurses to get that additional support. But definitely don't do this on your own. And then remember to ask for the help that you need. I know I said be proactive, but be proactive means that you will ask when you need to ask for help, and that you take on board, and that you're open to the help that is available as well. Read the leaflets. There's a couple of leaflets on the Eat Well guide, on the website as well. And so, it's important that you, as I said, ask for help, but take advantage of the help that's there already. So I mentioned the Sickle Cell Nutrition Academy, which is the non-profit organization that I've set up, and the website is there. There's a QR code that's coming up in the next slide as we bring the session to a close. And the reason why I set up this non-profit organization was, as I said earlier on, was to give me a platform so that I could address the knowledge and the care gaps that I identified through my doctoral research project. And so it's a three-pronged approach. It's looking at nutrition in terms of making available nutritional care, in terms of policy and practice, so that we can get more funding, so that when you do go and see your consultant or your nurse, that you can also ask about nutrition. So that's work that I'm doing through the academy, in terms of looking at the nutritional needs of the patients and addressing those gaps. But also education. I mean, this 4-session online program sponsored by the Red Cell Network is exactly, what is needed in terms of addressing and, as I said, bridging the knowledge gaps that we've identified through the research. And I'm really excited and grateful that we get to do this, and that I get to do this with you guys over the next couple of 4 weeks. So education is very important, but also nutritional resources. And so the next slide will be an image of some of the patients that were part of the NHS England project that I mentioned earlier on, where we developed nutritional resources to address this knowledge gap, but partnership working. So partnership with you and partnership with other stakeholders, so that we can, and I can, continue to do the work to develop nutrition and, improve your access and outcomes to nutrition. So I just wanted to share the vision, the mission, and the purpose of Scanner, as I call it, Sickle Cell Nutrition Academy. The vision for me, very importantly, for every sickle cell patient to have access to nutrition as part of your standard care. That is very important to me. That's the vision that I have for Scanner, and I will do all that I can to ensure that that happens. And so the mission is linked to that, to improve the access and outcomes of nutrition for people living with sickle cell disorder, as I said, through nutrition, policy and practice research, through education, training and resources, and also partnerships and advocacy. And then the purpose is helping people living with sickle cell disorder. I will change that to disorder, to improve their quality of life. So that's why Scanner is that important to me. And so just in conclusion, then, this slide, there's the QR code. So if you wanted to, take a picture of the QR code, that is to take you to the Sickle Cell Nutrition academy, but the compendium. So the compendium is actually where all the nutritional resources, including the Eat Well guide that I've shared with you, is uploaded. And this was, as I said, part of the NHS England project. And in the image just there are four of the sickle cell participants who kindly was part of this process, and it was a joy to work with and to learn from and put all of this together. So I just wanted to share an image of that as well. So do go onto the website, but also look at the compendium to get the other nutritional resources that's there as well. So 1 minute to go, or it's literally just gone 8:30. So one thing that you will take away from the session this evening, and again, feel free to put it in the chat. It will be great to look, after the session, what people were saying. But I want to encourage you to think about one thing that you will take away, just one. I mean, there may be lots, but just one thing that you take away, from this evening session. And I hope it's been beneficial. As I said, I'm excited to do session 2, 3, and 4, and I hope that you guys are going to join me. We've had a really good turnout, up to 60, just over 60 people on the call this evening, and that's fantastic. So, I want, as I said, I'm looking forward to next week and the next 3 weeks to be able to share more with you, where we're going to be more practical. This was laying the foundation. So we're going to be building on, what you've learned through this evening. But just to say thank you so much. Thank you for staying. It's a privilege to serve you in this way, and I definitely look forward to next week. So thank you. Yes, I like to leave all of my presentations with this quote by Ralph Waldo Emerson, and it says, "Do not go where the path may lead. Go instead where there is no path and leave a trail." So my challenge for you is, what is your contribution and what is your trail to improve and advance sickle cell nutrition for you, and for the future. So thank you once again. I'm going to stop sharing so I can see some of you online, but thank you so much.